Hello, everybody, and welcome to Care Talk, where we talk about your healthcare. My name is Laura Packard, and I have several experts with me here to answer your questions. And so please text or call in your health insurance questions to 202-838-6837, and we'll answer them in future episodes. And today's episode is going to be about Medicaid, more about what Medicaid is and what could be at risk next year. And I'm happy to welcome Nicole, the Chief of Advocacy and Campaigns at Caring Across Generations, to talk more about Medicaid.
Hi, Laura. So nice to be with you.
Well, welcome, Nicole. So tell us, for people that may not be familiar, what is Medicaid and how do you know if you have it?
Yes, what is Medicaid and how do you know if you have it is actually one of the most important questions because of how much is at risk. Medicaid is a health care program, health insurance program that covers many children, many people, many low-income folks, pregnant women, disabled people, aging adults, but also many more. It can cover family caregivers, but Medicaid is also a lot more than just a health insurance program. It also is the main funder when it comes to home and community-based care for older adults and people with disabilities, something that Medicare does not cover. So Medicaid is important for the health insurance components and also for those home and community-based services components. And also because of that, not many people know if they have it. Medicaid federal partnership, meaning that the federal government regulates it and funds part of it, but state dollars also fund it and states run the program, which means it's called different things in different states. So in Tennessee, it's TennCare. In Wisconsin, it's Badger Care. And so that's a really important thing to know when you're figuring out if you have Medicaid or not. Some people too, if you have a waiver, that's Medicaid. So it is really important to know if you're covered, if your home and community-based services or your health insurance are covered by Medicaid.
Thanks, Nicole. And what is home and community-based services?
Home and community-based services are the services that keep people in their homes and communities. It can be anything from assistance with personal care, assistance with groceries, assistance with budgeting, cooking. It's those services that people who have needs when it comes to activities of daily living that they get in order to stay integrated into their homes and communities.
And who's eligible for Medicaid? If somebody doesn't have insurance right now, how can they find out if they can get Medicaid in their state?
Yes, so Medicaid eligibility does vary by state, so it's really important to insert the name of your state, insert Medicaid, and it will lead you to that office. Again, it might be called something different, but Medicaid is definitely a common term. And eligibility does vary. The federal government sets a floor for eligibility in terms of level of need, in terms of income eligibility. That's a really important thing to note, is that there's very strict income and asset limits when it comes to eligibility for Medicaid. Also, then there's also the children health insurance program that's covered through Medicaid. So there's a lot of different components when it comes to eligibility, which is why it's important to look at your state Medicaid website to figure out if you're eligible and also if there's a waiting list, because the reality is that for some Medicaid services, it's not a guarantee that you'll have access right away, but it's very important to get the paperwork in and make sure that you are in the queue for the services that you need.
And can you tell me a bit more about a thing that people talk about, Medicaid expansion, that was a part of the Affordable Care Act and means that millions of Americans might have insurance through Medicaid in their state this way?
Yes, definitely. So Medicaid, again, is called different things in different states, and it was expanded under the Affordable Care Act, and all but a handful of states have picked that up, and that is coverage for health insurance. And a lot of family caregivers have gotten coverage that way. And what it did is it expanded some of those, it got rid of or raised some of those income eligibility requirements, raised some of the federal funding going into the program to cover that insurance coverage. So it allowed for a lot more people to get covered when it comes to those vital health insurance services through the Affordable Care Act via Medicaid expansion.
And there are some big states like Texas and Florida and Georgia that still haven't expanded Medicaid rights. So there are some places where working families might not be able to get into Medicaid, even though in other states they'd be eligible, right?
Yes, definitely. So some states, like those that you mentioned, have not expanded Medicaid, which means that those states are not getting the additional federal funds. And also it means a lot of people are going without health insurance coverage in those states because those state legislatures have not taken up Medicaid expansion, which is a really short-sighted decision and something that obviously advocates all over are making sure that those last standout states are going to join in because Medicaid expansion has really, really helped a lot of families to get the coverage that they need and led to the highest insured rate that this country has ever seen.
Can you talk some about next year? And we've heard various names for people that Trump might appoint to the Department of Health and Human Services and other agencies. And we've also heard things that they may want to do to these programs next year. So can you talk more about that? What's going on and what could happen to Medicaid?
Yes. So unfortunately, with the election of President Trump, we saw those of us that are advocates for Medicaid are very worried because the last time that President Trump was in office, there was a real bullseye on the Medicaid program in terms of cutting the program to find funding for other things. So we're really worried about them doing the same thing because it is covering 80 million people. That has a high cost, but obviously it's something that the government should be doing. And we're really worried about some of the appointees that he's discussed, including Robert F. Kennedy Jr. as the head of HHS and Dr. Oz, the TV doctor in charge of the Center for Medicare and Medicaid Services, particularly because Dr. Oz has in the past done a lot to monetize different programs and privatize different programs. So when it comes to Medicaid, which is a federally and state funded program, that would be really harmful. And there's a lot of congressional members too who are talking about some of the same things that we saw in 2017 that would greatly restructure the program in a way that would eliminate services and put a lot of people's coverage at risk.
Can you talk some about what those specific things that people, if somebody's reading the news or they see something online about, block grants or per capita, or can you explain some of the terms that people might be hearing next year and what that could actually mean to our healthcare?
Yeah, absolutely. So it's really important to understand what Medicaid is. And it's also really important to understand that any of these words, per capita cap, block grants, work requirements, all of those things ultimately are cuts. If you hear any of those words, what they mean are cuts. But when it comes to block grants and per capita caps, what it would mean is the federal government, instead of right now, any state has a negotiated rate. So I'm in my home state of Illinois. The state of Illinois knows that if they invest $1 into the Medicaid program, that's going to be matched by the federal government. The per capita cap or block grant would eliminate that. The federal government would just pull one big pot of money and that's all you get. If you can't cover anybody or if people need to lose coverage, too bad. And that is exactly what would happen because any block grant or per capita cap that has been proposed is not in line with how much services actually cost. It's basically a math equation based on the consumer price index that would ultimately mean in 2017, the last time they talked about per capita caps and block grants, we were looking at almost $1 trillion cut over 10 years, which would completely devastate the program.
And why are they talking about these cuts right now? This is something that under the 4 years of the Biden administration, they've been working on expanding healthcare. So why are cuts on the table next year?
Yeah, that's what's really confusing because when you look at what the Biden administration did do, including in 2021, the American Rescue Plan Act included funding specifically for expanding Medicaid home and community-based services, and all 50 states took that money up. That just shows that it's a huge need for states, so giving them less money really doesn't make sense. And really the reason that they want to do that, the things that we're hearing from Congress and in the media, is that they want to cut Medicaid. So again, cut insurance, cut home and community-based care for disabled people and older adults to fund the continuation of the Trump tax cuts. So that's why they're looking at it, because Medicaid is a big investment from the federal government. And it's maybe the only investment outside of defense where they can find the amount of money that they need to give tax cuts to the wealthy and corporations. And that's just unacceptable when we're talking about healthcare coverage and literally life and death for a lot of people who are on the program.
So they're talking about taking away access to healthcare for disabled families and seniors to help fund tax cuts for people like Elon Musk.
Yes, that's exactly what they're doing. It's not even a question. What they're doing is saying we need a big chunk of money, Medicaid, again, covering health insurance, covering the home care for older people, covering job coaching for disabled people. They want to cut that, again, to the tune of $1 trillion in 2017. So we assume that that's what they're going to do this time, to fund tax cuts for not only folks like Elon Musk and the Trump family, but also for corporations, which is just unacceptable from a policy perspective.
So what can or should people be doing about this if they believe that we should be expanding healthcare instead of taking it away?
Yes, what's really important is that folks, again, know your own coverage, know if you are covered by Medicaid, so that you can share your story and advocate for the continuation of those supports. And not just advocate with your legislators, but also talk to your family and friends. Because if you don't realize, let's say, hopefully you're listening to this and Googling and figuring out that you are covered by Medicaid, or like me, I know that my brother Chris, who has autism, his Medicaid home and community-based care is covered. And it's really important. We're coming up on the holiday season. You don't have to get political, but we can talk about the fact that it's unacceptable for those who are representing us in Congress to be making these decisions. And the best way to really get to the heart of the issue is to share those personal stories. You don't have to be an expert on Medicaid. You just have to know that Medicaid is what's covering you and talk about what that means in your life. And that's what we're going to have to do, because we're going to have to mobilize to show all the different faces of Medicaid and why Medicaid matters.
And you mentioned this is 80 million people potentially at risk, and America is a country of over 300 million people. So we're talking about 1 in 5 Americans has Medicaid. Is that right?
That is right. It's a huge program that touches so many people. And again, not everybody realizes it, but people are going to realize it when they don't have the health coverage that they need, or when they don't have the home care that they need.
Yeah. So this is incredibly important to educate yourself about Medicaid and figure out perhaps you are on it and weren't aware because it's called something else in your state. And take the time this holiday season to talk about it so people know what's at stake. And tell us what organization you're with and how people can keep following this Medicaid fight.
Yes, definitely. So at Caring Across Generations, where I am the Chief of Advocacy and Campaigns, we will be working along with our disability and aging partners and other healthcare advocacy partners to really elevate this issue. So you can follow us at Caring Across Gen on all of the channels. And again, making sure that you're sharing your story, because that's going to be the most important thing in whatever way you feel comfortable.
Thank you for joining us, Nicole. And it's a good reminder that care can't wait. And
Yes.
our first question from our viewers is actually about Medicaid. This question came in via text. My question is in regards to Medicaid. My grandson, who will turn 2 in January, was diagnosed with diabetes early this year. He's currently on Medicaid, and insurance so far has covered all medication and devices he's needing. My concern with all that is with all the healthcare changes coming. We're afraid his insulin pump, or his Dexcom will no longer be covered. Should we consider applying for the Affordable Care Act as secondary insurance? And to answer that question, welcome Louise from healthinsurance.org.
Thank you so much, Laura. It's nice to be here. So this is a really good question, but it is important to know a few things. First of all, Medicaid is always secondary. If you have any other insurance in addition to Medicaid, Medicaid will be secondary, not primary. And some states will not let you have other insurance in addition to Medicaid. So that does vary state by state. You really need to check with your state to see if you can get additional insurance that would be primary, and then your Medicaid would become secondary. But so that's a logistics part of it. Going to your original question about should you consider this, if you are eligible for Medicaid, you will never be eligible for subsidies in the marketplace. So if your state allows you to have another health insurance plan, you would be paying full price for it. So I would say that's fairly rare for people to do that, even if they are allowed to. And then also going forward, I mean, we really don't know. As Nicole was explaining, Medicaid certainly potentially has a target on it as far as a way for the government to start cutting costs by reducing coverage there. But we don't know what's in store for the Affordable Care Act itself. So marketplace coverage, we could potentially see changes down the road there as well. But when we do see changes in healthcare programs, they tend to take effect at some point in the future. If legislation is passed or new regulations go into effect, they don't usually have an immediate effective date. So this would be something where if coverage is changing going forward, we would have some warning and some heads up going forward. So I would say at this point, if you're eligible for Medicaid, be enrolled in Medicaid. You can check with your state to see if it's allowed to have additional coverage, but you would not qualify for any subsidies for that. And again, Medicaid will never be primary if you have another health plan.
Thank you, Louise. And next, bringing on a new expert, Rachel Madley of Center for Health and Democracy, to talk more about Medicare. So Rachel, please tell us about Medicare open enrollment, since it's going on right now. How long does it run for, and what do people need to do, if anything, if they're on Medicare?
Thanks for having me, Laura. And this is such an important question. So Medicare open enrollment started on October 15th, and it runs until next Saturday, December 7th. Now, if you are enrolled in Medicare Parts A and B, which cover hospital and doctor services, also known as traditional Medicare, that will renew automatically. Enrollment in private Medicare Advantage plans, as well as Medicare prescription drug plans, known as Part D, will also renew automatically as long as your plan is still being offered by the insurance company that's running it. There are some changes in what plans insurers are offering, so be sure to check that your plan is still being offered. If you don't want to make any changes, you don't have to do anything because that renewal happens automatically. But during this period, you can also make changes such as switching from traditional Medicare to a Medicare Advantage plan, switching from an Advantage plan to traditional Medicare, and you can also switch your prescription plan and even switch between Medicare Advantage plans. And that's when you can really look at all of your options and decide what's best for you. And every state has a state health insurance assistance program, also called a SHIP, where you can go for unbiased advice on which plan is right for you.
Thank you, Rachel. And next, let's talk about the Affordable Care Act open enrollment, since that's going on right now too. So welcome back, Louise. Tell us about the deadline and how do people sign up for insurance through the Affordable Care Act?
Sure. So health insurance for people who buy their own health insurance. So you don't have access to an employer's plan or Medicare or Medicaid, you need to get your own coverage. That enrollment window is going on right now. In most states, December 15th is the deadline to have coverage that starts January 1st. There are a few states where they have a later deadline, but you should really, in the back of your mind, be thinking December 15th. That will, in every state, if you sign up by December 15th, you for sure will have your plan effective January 1. In most states, the enrollment window does actually continue until January 15th, and in a few states it even goes past that. But in most states, if you're signing up after December 15th, your plan won't take effect until February 1st. So you would have either the first month of the year, you'd be on a renewed plan that just automatically renewed if you currently have coverage, or you would just be uninsured if you don't currently have coverage. In most states, kind of similar to Medicare, most plans are still available in 2025. So if you already have individual market coverage and you just want to keep it, in most cases, you can just do that by doing nothing. But we really don't recommend that because there are plan changes every year. There's changes to the benefits themselves, to the provider networks, to the drug formularies. And there's also new plans available in some areas. There are some areas where existing plans are leaving. So you really do just every year need to take advantage of the opportunity to look and see what's available for next year. It might still be that the same plan you have this year is your best option for next year, but it might not be. You might be better off switching. You can switch during this window. It does not matter what your medical history is. They don't ask any questions about your medical history. You just can pick any plan that's available to you. As long as you're shopping in the marketplace, you can potentially qualify for income-based subsidies. Most marketplace enrollees do get those income-based subsidies. So shopping in the marketplace is usually the best option for most people. But that open enrollment period also applies to plans that people buy directly from insurance companies. You just have to pay full price for those. There's no subsidies outside the marketplace. So starting at healthcare.gov is the marketplace that's used in the majority of the states. But if your state doesn't use healthcare.gov, you will be directed to your state's marketplace from healthcare.gov. So you can start there. It'll send you to the correct website, and then you can shop from among all the available plans. You can get help. There are brokers and navigators in every community who will help you. There's no charge for their services as far as understanding what's available and getting you enrolled.
Thank you, Louise. Our next question is, what's the difference between traditional Medicare and a Medicare Advantage plan? Rachel?
This is such an important thing as we're in open enrollment. And so the main difference is that Medicare Advantage plans are run by private health insurance corporations, think Aetna, United, whereas traditional Medicare is run by the Centers for Medicare and Medicaid Services. Medicare Advantage plans cover the services of Medicare Parts A, B, and D, so they cover your hospital, your doctor, and your prescription drug benefits. The two things to consider about Medicare Advantage plans is that there are limitations on care that you can get that don't exist in traditional Medicare. Medicare Advantage plans require prior authorization for thousands of different medical services that you might need. And that means that you will have to get insurance approval before you get your care that your doctor prescribed for you. And oftentimes the insurance company can actually decide to deny that care and not cover it. Traditional Medicare rarely requires prior authorizations and mainly only requires it for cosmetic procedures. The second thing to keep in mind when you are looking at Medicare Advantage versus traditional Medicare is that Medicare Advantage plans have specific and oftentimes narrow networks of doctors that you are allowed to see, whereas traditional Medicare allows you to see any doctor that accepts Medicare's approved payment rate, which is almost all doctors in the US. And so as open enrollment goes on, you've probably been seeing a lot of television ads for different Medicare Advantage plans because insurance companies heavily advertise these and sometimes offer some small upfront discounts to entice people to join their plans. But I really encourage you to look at the plan and think about the hefty obstacles to care that can come in a private Medicare Advantage plan when you're thinking about whether you should stay in traditional Medicare or choose an Advantage plan.
Thank you, Rachel. Our next question is Ashley that says, help, it's urgent. I can't find a dental provider. Louise, do you have some thoughts for Ashley? It's unclear if Ashley has insurance or not.
Sure. So if you do have dental insurance, your dental plan will almost certainly have a provider network that you need to make sure you're using a dentist who's in the provider network in order to have coverage. So if you do have dental insurance, you should start by looking at your dental plan's provider network and then contacting the providers who are listed as in network. Make sure that they are indeed in network. There are sometimes errors in provider directories, so the dentist may have left the network and the directory didn't get updated, for example. So you do want to confirm that they are indeed in network and that they're accepting new patients and can get you in within a reasonable time frame. If you do not have dental insurance, obviously you're free to go wherever you want, but you might find, you definitely want to call around. Don't just take the first dentist you talk to, because you might find that some dental offices will offer discounts if you can pay in cash. Some will offer like an annual membership where you pay them a fee and then you get a discount on any services you need during that year. They may include like a free cleaning checkup as well. So obviously you have a lot fewer restrictions if you don't have dental insurance, but you also are paying the full price, which may or not be discounted depending on the provider you use.
Thank you, Louise. And I personally don't have dental insurance, but my dentist does have a membership plan where it is cheaper to become a member than it is to pay out of pocket for cleanings and such. So do the research, look around, and find somebody in your area that is willing to work with you. Our next question is from George that wants to know, can you get Part G through Medicare? G as in George. Rachel.
This is a great question, and the different parts of Medicare can sometimes seem like an alphabet soup. So for those who are listening, the Medicare Supplement Plan G is also known as Medigap. And what this plan is it is coverage for additional out-of-pocket costs for someone on traditional Medicare. So they have coverage for parts A and B. And these plans are sold by private insurance companies. So you cannot get a Plan G or a Medigap plan from the Centers for Medicare and Medicaid Services, but private insurance companies like Aetna, Cigna, and those do offer Medigap plans. A Medigap plan will pay for coinsurance costs that you will be responsible for services provided under Medicare Part A and Part B. So what does this look like in real life? If you're on traditional Medicare and you have a hospital stay that's covered under Medicare Part A, you will have a 20% coinsurance payment that's due. So 20% of the hospital bill is something that you would be responsible for. If you have a Medigap plan, so if you have a Plan G, that plan will pay your coinsurance. So it's lowering your out-of-pocket costs. And again, you can get those during open enrollment from private insurance companies. And one thing to remember is if you enroll in Medicare Advantage and then you want to switch back to traditional Medicare, it may be more difficult to get a Medigap plan. So before you make the switch from traditional Medicare to Medicare Advantage, make sure you consider that, because if you want to switch back, it can be more difficult, again, to get that Medigap, that Plan G plan.
Thank you. And in the next episode, we'll go more into the alphabet soup of Medicare and what all the different parts are. Thank you, everybody, for joining us today. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. And tune in next week where we will have more healthcare for you, more questions, more answers, and a special guest will be talking about reproductive healthcare and what could be at stake next year. So thank you very much. This is Care Talk.